Hello and welcome to 72 Dragons House. Today we had the pleasure of speaking with Sapna Suresh. Sapna Suresh is a senior researcher at Western University, specializing in the intersection of communication and media psychology and health. Currently pursuing her PhD in communication studies, she has experience in persuasive messaging with focus in understanding the psychosocial effects of media. She envisions channeling her findings to positively impact health, science, and environmental communications. She has research experience as a research consultant, where she evaluated the impact of entertainment programming on global audiences. Her background, PhD and MA in communication studies, and a BA in engineering and policy studies, reflects her unique approach in bringing technical and social aspects in her research. Welcome.
Thank you for having me.
How did you become interested in the intersection of communication and media, psychology, and health? Can you provide an overview of your current research focus at the Western University?
Yeah, absolutely. So when I started graduate school, I had a particular interest in seeing how message design and how audiences process messages could impact environmental outcomes. I came in with this specific interest on climate change, on reducing plastic waste and things of that sort. But what I started to realize was environmental communication really sat within this larger framework of health communication. There's quite a rich body of literature and years that people have spent studying health communication, and really the frameworks and the approaches that people use towards risk communication, health promotion, health prevention, that's very much translatable to contexts such as environmental communication. So currently I'm taking kind of a broad approach, looking still at media, message design, message processing, but I'm particularly interested in focusing on right now the issue of misinformation. So we know that this is obviously very salient, very prominent in the COVID and post-COVID era. And what I am sort of focusing in on is how do people who are, well qualified speak about health? How do people who come from less qualified backgrounds speak about health? And what are ways in which we can, use our knowledge of persuasive methods, persuasive communication to make sure that appropriate, correct messages are expressed, and that, we have vehicles for mass communication that sidestep or thwart the negative effects of misinformation.
So now you talk about misinformation. WHO, the World Health Organization, and other national, international agencies are very concerned about misinformation. So what do you, from your research, what are you finding out there regarding misinformation?
Right. Yeah. So I think something that's really interesting is, in persuasion research, we really think about attitudes and behavior. Does exposure to certain messages impact your attitude, and does it impact your behavior? Does it make you agree with the message? What's interesting is when it comes to misinformation, and specifically the way that it spreads on social media, people don't necessarily have to believe that it's true or really find it accurate at all to engage with it. So the sort of unfortunate byproduct of people, commenting on things that they think are ridiculous, maybe like reacting with the angry emoji or with the sad emoji, all kind of has this cumulative effect of it still spreading throughout their networks. And the problem is, you can't control who gets exposed to those messages. The slate of factors that each individual has very much dictates how they process that information and whether they do believe and share that information both verbally, interpersonally, or online. And so it's really a tricky issue of figuring out how to get people to stop sharing stuff that they don't even agree with, in addition to obviously trying to get people not to believe in or accept this kind of harmful information to begin with. So one thing that I'm looking at is, there's a long history of studying the impact of narratives and storytelling and how that can be kind of a special way to persuade people, because it combines emotion and imagery and attention in a unique way where people aren't counter arguing with the message so much, and they're more readily accepting it, or they're more readily engaging with it. And what I'm looking at is, can we apply these theories from the narrative paradigm to the issue of misinformation and see maybe if we make it a worse story or a less engaging story experience, maybe that makes people less inclined to engage with it.
We are at APHA 2023. Most people and organizations are in public health. So what would you tell those organizations regarding media and technology? Now the messaging is changing. This is a new era. What do these organizations need to do to catch up?
So I think it's really important that you have, people who are plugged into the science of health communication and understand that there are nuanced ways that you have to communicate with different subgroups, because for different slices of the population, be they cultural differences, regional differences, there are unique approaches that you must employ to effectively reach those people. So I think it's important that these agencies have teams of trained health communication professionals who can help give them insight and know how to approach the research in the right way. I think it's also interesting and important to remember that, while social media is increasingly important and increasingly prevalent, that doesn't mean that other forms of communication are unimportant. For example, I recently worked on a project with California Department of Public Health that looked at this disease called valley fever, which is caused by a spore in dusty areas. And what we found is that, this is highly threatening primarily to people who work outdoors. So construction workers, migrant farm laborers, and a lot of these people don't have, and it's in a fairly rural areas too, the Central Valley of California. And a lot of these people don't necessarily have the same level of, could say, plugged inness to social media tools, novel media technology that people maybe in more urban centers do, just because we know about the wealth disparities that exist between rural and urban centers. And so we found that it was actually especially important that they continue to use things like doctors as a primary vehicle for getting location-specific information to patients, that you use bus ads, that you use highway billboards and things of that sort, where it's like incidental encounters, and then also health professionals giving this information. Because while social media is great and it definitely can have a particular effect in urban areas or on younger people, it's important to remember that there are areas where, lots of parts of this country where a significant chunk of people don't have access to high-speed internet or don't necessarily all have smartphones, and the access to information has to come through more traditional mass media channels. It's important we still educate those people and make them feel efficacious in protecting their own health.
Definitely a new era. Now, I believe your research talk about also media entertainment. So when we think about public health, we don't really think about entertainment. But how would you connect entertainment in public health?
Yeah, that's a great question, and this is definitely sort of a secondary interest of mine. There's this method called entertainment education that has been employed for decades, and it all started with a producer called Miguel Sabido in Mexico, who wanted to understand, why certain messages, why certain programs, certain novellas were especially impactful on the population in terms of their health behavior and health behavior change. And, eventually he developed this thing called the Sabido methodology, which shows that, if you have positive role models, negative role models, and transitional characters, you show people either being reinforced after making positive decisions or experiencing sort of the harms after making a bad decision. People can vicariously learn, and they can undergo that same sort of evolution as the transitional character, ultimately putting into practice the same positive behaviors that are advocated for in the program. And this, methodology has been put into practice in many countries around the world, from, Latin America to even here in the United States and countries like Nepal. this has really been a great tool to normalize the playing field when it comes to information access, because we know one of the biggest challenges is, based on where you live, based on your socioeconomic circumstances, the quality of education that you might be receiving in schools or from your family could vary quite widely. And as public health professionals, it's really important that everybody has access to high quality information. And so when public health professionals can work in tandem with entertainment producers and governments to ensure that accurate messages are, being expressed through high quality, engaging television, stuff that people would tune into otherwise, but they're also being reinforced with these positive health messages. That can be really effective, and especially in the areas of gender-based violence and reproductive health. This has been shown time and time again to really be a good tool for encouraging positive health behavior change.
Great, yeah. We definitely can take the example of the telenovelas and entertainment. That would be very helpful for public health. Sapna, thank you so much for sharing with us today, and enjoy a PhD.
Of course, thanks for having me.